Welcome to Rebel Nurse, the podcast that's here to show you just how bold and diverse the world of nursing can be. I'm your host, Erica Browning. Whether you're curious about unique career paths, need a dose of inspiration, or just want to feel seen and celebrated, you're in the right place. So grab a cup of coffee, an energy drink, or whatever keeps you going, and let's dive in. Hi, Claire.
Hello.
Let me introduce you to everyone. This is Claire Phillips. She is a registered nurse and she has her DNP. Hello. And she has, like so many nurses, we're always doing all the things. It's what we do. She is currently working as a patient navigator manager, and she's going to tell us what that is. And then she has her own business called Nursing the System, and she healthcare change specialist, coach, consultant, speaker, all the things. And she's currently living in the Netherlands. So if you follow her, then you already know this. But we're going to go through her story. I'm so fascinated. Hi, Claire. Welcome to the show.
Hello. Thank you for having me.
I started out, I said that you were living in the Netherlands, but where are you from?
That's a loaded question because I have lived a lot of places, but I'm originally from California, I like to say. I lived there the longest as a child. I was born in Kentucky, but only lived there a few months. So mostly in Northern California, Bay Area, but I spent 6 or 7 years of my 20s in Minnesota, which is where I did all my nursing schooling and early career work. Minnesota also feels a bit like home as well.
Yeah, it's cold there.
There is. Don't miss that.
No, I live in San Diego. I'm not from California either. I'm from Texas, but I live in San Diego. And sometimes I miss the seasons, like a good coldness, and then it warms up. I don't think I could do that much snow. I just don't think my little San Diego heart could take it, but I like visiting it. But anyway, okay, so you went to nursing school in Minnesota.
I did. Yep.
Is that where you got your first nursing job? Did you always know you wanted to be a nurse?
I didn't, and I don't say that because I didn't want to be a nurse. It honestly was not something that ever crossed my mind. Looking back gives me a lot of pause because why not? And I think a big part of it was it just was not represented to me in media very much. If we think about medical television shows, they were never like, oh, wow, look at these nurses and their incredible job that they're doing. It was like, where are they? Non-existent.
It's Where Are the Doctors is what it was. It was George Clooney in ER as a doctor and everyone's interested.
Yeah, nursing just never crossed my mind. What I saw around me, I grew up in Silicon Valley, so it was like lawyer, doctor, software engineer. Yeah. Those were your 3 tracks. If you were someone who liked school and wanted to go to college and was motivated in that way. I went to a small liberal arts college in Kentucky. I went back to Kentucky for that. And I took a lot of sociology and anthropology classes, and that ended up being my major. When you take those classes, you learn about all the social systems and how they work together and how they don't work so well together. And healthcare stood out to me as like, ooh, wow, this is a big challenge because being in the United States, learning about our healthcare system, it's like, so what's the problem? Because we have a ton of resources. We have brilliant minds in our different professions. Our hospitals are well resourced. We've got the world's best cancer centers all over the place. What's going on? And so when you start to dig into it and look at structurally what's going on, it's deeply troubling. And you realize, okay, this is not going to be an easy thing to turn around. And that's actually when I became interested in nursing, because I was like, well, who's actually doing work in the healthcare system? Where is there opportunity to make some change? And I took this one class. I always tell this story, so if anyone follows me, they've probably heard me tell this before, but I took this class, I think it was my sophomore year, maybe my junior year, called Sociology of Health and Illness. And we learned about the different health professions, primarily nursing and medicine, and the primary theoretical differences between them. So in a nutshell, care versus cure, disease focused versus whole person care. And that's obviously like a really, really simplistic definition. But that particularly got me interested in nursing, looking more into the profession, learning more about nurse practitioners and sort of the blowback that nursing has received consistently when trying to challenge the status quo in healthcare. And I love a rebel, so that really interested me. And I thought, well, how do I get involved in this profession? Because it seems like they're doing some stuff that really is making some old white men mad.
Well, we love a rebel around here. And that's so interesting, though, because your story is probably the first perspective I've heard of someone getting into nursing from that point of view, that you majored in sociology and it was more early on, it was like a systems thing to you that you wanted to affect. That's why I ask everyone, like, how did you get into nursing? Because there's a million stories and none of them are wrong. So if someone hears this and this resonates with you, or maybe you started in nursing for one reason and now you're like, okay, I'm ready to move on from whatever that reason was. This reason that Claire's giving sounds really appealing to me. So, with that in mind, what was your first job? Like, how were you going to get into it?
Yeah, great question. Let me tell you what I did after college because that'll help loop in the Netherlands question, which I know you're curious about. So I decided mid sociology degree I wanted to go into nursing, which was a little bit weird. And so I had to figure out how I was going to do that. And I ended up realizing that if I went to a master's entry nursing program, that was going to be the cheapest way for me to effectively become a nurse. And so I recognized that was going to be an accelerated, intense program. And I was coming out of a really, really rigorous 4-year college experience where I decided to, like, as any good nurse would, do literally every organization, every project I could get my hands on. Why not? Sign me up. So I was burning out and I wanted a nice year off, a gap year. So I decided to go be an au pair. And so I ended up initially in the Netherlands. Total fate of the Google search, like, didn't know much about the country at all, to be honest. Just was like, yeah, looks cute. Let's go. So I found a wonderful host family and I moved in with them for a year. And I loved the country. I had a really great time living here the first time. Never thought I would stay because I was going back to the US to be a nurse. So I moved to Minnesota because I did the University of Minnesota's master's program. And that was 16 months. And then I started working in the ER as a new grad.
Yeah, that's what I did.
Really?
Yes. So I did a second degree program, and I guess it was like the last semester. It was 16 months. In that last semester, you do some sort of practicum where you go on the floor, and I was in the ER. That was my practicum.
Me too.
And it was at the hospital that I went to work for. So they had been able to see me for 6 months and I'd been able to see how they worked. I still had to do breathing exercises because I was so stressed. It was a very busy hospital. It was 900 plus beds. I mean, it was massive and we were new. It's challenging. I liked my time in the ER. Did you like your time in the ER?
Yeah, I really, really liked it, actually.
How long were you in there?
I worked, quote unquote, bedside for 3 years before I moved into a ER leadership position during COVID. I ended up switching ERs in order to take the job. So I did not start in a crazy busy ER. I started in a tier 3 trauma center, which is funny calling it a trauma center when it's tier 3. But it was busy. It was like on the border of the rural part of the Twin Cities. We had an interesting mix of population and different disease types, and we had a really high psychiatric patient population because there was a psychiatric hospital attached to our facility. So that was a really interesting experience. But anyway, so I moved from a tier 3 to a tier 2 when I moved into management. And it was during COVID. And that was even more intense than what I was coming from, which was interesting. But yeah, I really liked the ER.
Yeah. So this whole time, is the leadership and systems changing, changing systems in the back of your mind as you're making your move here?
Yeah, totally. I went through nursing school with that in my mind. I actually picked the University of Minnesota because their master's program had a lot of coursework and training in leadership and systems thinking, even just at the master's entry level. And I knew that they had a DNP program that I was interested in, which is the one I ultimately did, which is the Health Innovation and Leadership track. And I knew that if I did the master's there, I could transfer my credits. So it was always sort of like the master plan, if you will, to go into that like leadership systems change route after all the sociology nerd in me was like driving.
When did you finish your DNP then?
I finished my DNP in 2022.
And so you're in this leadership position, which is what you're working towards. And then you already had your master's, but then you got your DNP. At what point were you like, okay, now it's time to leave bedside, the ER bedside, and do something else?
I started my company technically, like, I registered it as an LLC in 2020, but I started blogging under the name Nursing the System in January of 2019. So almost 2 years before I registered as an LLC. And I didn't have an intention of starting a business or being an entrepreneur. I just was like working as an ER nurse, talking to my colleagues. I was seeing the sociology connection to everything that we were seeing in the ER, because I say this all the time, but the ER is basically the intersection of all the broken social systems in our society. And it's very confronting. And I think a lot of ER nurses will relate to that. It's just like, oh, great, substance abuse and homelessness and immigration challenges. And all of this is in one patient room right now. And it's just hard to feel like you're making an impact as an ER nurse, and I'm sure other nurses can relate to this as well.
I can. I was an ER nurse. You have all of that, plus strokes, plus heart attacks, plus more coming in. You're like, good luck with that.
The control that I have in this situation to help this person is like a drop in the bucket of what's impacting their actual life and health outcomes. And of course, we all know about social determinants of health, but from a systems perspective, it's like these broken systems are creating this, like, I don't know. I think of a bank, like a heist movie where you have all those lasers and they're intersecting and you're like, how do I step through this wall of death? That's what I would picture in my head when I would meet patients who just had like all these lasers to try to move through because of the intersections of how our society was not there for them and failing them.
So you decided to make a change out of the ER.
Yeah, back in 2019, I was blogging about this stuff and I kept getting really insightful questions from people who read my blogs. And a lot of people would be like, okay, Claire, but what do we do? Like, thank you for putting into words what I've been feeling. Just because I had some like sociology terms I could throw into a blog post. And I was familiar with how to kind of talk about that and construct an argument that would land with people, with nurses. And so there was appreciation for that. But then people wanted to know how to fix it. And I was like, well, I don't know. I mean, I'm 24. Not that 24-year-olds can't know stuff, but I had all of this like motivation and I had this feeling like nurses can be the change. And like, that's why I went into nursing, was what I recognized. But we have this like untapped power, and nurses as a group, we don't have the best self-concept about what we're capable of. And I wanted to help change that. So I had all this like rah energy, but in terms of like tools, practical answers, no, I didn't have that. That's what propelled me to, for sure, sign up for my DNP program, because I wanted to help. I wanted to like pay all that money, because DNP programs are freaking expensive. I wanted to pay all that money and give 3 years of my life and just dedicate that early professional period to learning what I could to give it to nurses, because it's one thing for me to have that knowledge, but I've always asked myself, how can I like leverage what I have to make a bigger impact? And that's that systems nerd in me. But it's like, if I can go through this, I don't want other people to have to do it, to be honest. Like, if you want to go get a DNP, amazing. Love that for you. But you shouldn't have to, in order to feel like you know how to make an impact beyond the one-to-one patient impact, which there's nothing wrong with. And obviously that's so vital and critical to healthcare. But I know that a lot of people, in addition to wanting to serve patients individually, also want to feel like they're not just putting, knee braces on people and sending them out back into the ice storm, but they're able to also, alongside of that one-on-one work in parallel, be removing barriers that are going to keep people coming back.
Yeah. So you basically took your sociology background, went into nursing, and you're like, okay, I want to be able to, one, learn the tools for myself to make change, and then help other nurses do that thing. And so that's kind of, well, it wasn't how Nursing the System, which is your company, Nursing the System, was born. That started as a blog. Like you said, you had no intention of doing anything with it, but that's how it evolved through your evolution. You're like, okay, I've been blogging. Let's add this other component to helping nurses change the system without having to get a DNP. Did I get that right?
Absolutely. You nailed it. Yeah. It was a very organic process and build, because basically I started getting questions like, what do we do though? That's all great. What do we do?
A lot of nurses feel that way. They're like, okay, I hear you, but now what? I got a patient in room 2.
And some of it, I got some heat for it. That's another podcast episode.
Oh my gosh. I never understand that.
I don't want to say I fully understand it because I'm like, why would you hate someone on the internet like that? Like, calm down. But I also do get it. We can talk about it. It's interesting. I think people love seeing drama. I mainly got pushback from two groups. And that's not to say that I never said anything on the internet that didn't need to be like critiqued or challenged, because I think there was a lot of naivete on my behalf in 2019 for sure. But I also think that you don't need to be like a 40-year veteran nurse to have an opinion or to speak about your nursing experience. So I think there's a little bit of that going on. But the two main groups that I got pushback from were physicians who did not appreciate me questioning what I call the healthcare hierarchy, where physicians are at the top of this pyramid of professions, where nurses fall somewhere in the middle and our quote unquote paraprofessional colleagues are at the bottom and the patients aren't even on the pyramid. That always really bothered me. And I don't think I'm the first person to say this, but healthcare should not be a pyramid. It should be a web. It's a team effort. And if you look at the data, literally conceptualizing the healthcare team in a flat hierarchy versus a pyramid is incredibly beneficial for provider well-being, for patient outcomes. It's a no-brainer. But especially in 2019, like pre-COVID, when everyone kind of bonded in the healthcare space, there was a lot of angry physicians. I got a lot of hate emails.
About what? They didn't want nurses having input? Like, what was their problem?
I wrote a blog post called The Privilege of Physicians, and it was, I thought, quite measured. I was always a very careful communicator. At least I tried to be. And some physician found it and shared it in a Facebook group of physicians, of like thousands of physicians. And basically was like, look at this little nurse, like, go flood her DMs. They did.
Oh, no.
Yeah. A lot of it was pushback against nurse practitioners. I'm not a nurse practitioner myself, but I've always really looked up to them for what they're doing and how they're filling the gaps in our primary care shortage and non-primary care nurse practitioners. And so I would say things like, don't call them mid-levels. I hate that term. They're not mid-level anything. A lot of them have terminal degrees in nursing. They're not mid-level. They're doctors. People don't like to hear that. If you're a physician and you're told by the AMA that you need to protect your scope of practice at all costs because nurse practitioners are coming for your jobs, and there's a lot of fear-mongering out there.
I didn't know this. I've seen your stuff. Obviously, I've seen your stories. I've seen your posts. I've never seen you be rude. Everything you've done is measured. Even if it's a tough subject or a subject that people may not agree with, that's fine. Who cares? But you've never been rude and nah. So I'm sorry. Pushback, disagreement's one thing. We can take people disagreeing with us. Were they nasty to you?
Yeah, I'd open my blog inbox in the break room or something during a shift, and it would be like, you better watch your back was the subject line. And I'm like, are you kidding me?
Oh, stop.
It wasn't anything where I was like afraid, truly. I'd shed a tear and be like, everyone hates me. Like, I'm just a girl. Be nice. I don't know. I think that if you're going to exist on the internet, it's highly likely that someone's going to come for you at some point. And as horrible as it was to experience, and people have lived through so much worse, mine really was quite mild in comparison to what a lot of people deal with. But I think it was formative, and I think it definitely encouraged me to further consider the consequences of things that I say. And if I'm going to say something, do I really stand by it? Because it could cause some disruption down the line. So I think there were certainly good things to come from it. Also some negative things. Like, I think I still carry a little bit of concern. Like, I was hesitant to start my podcast because I was like, I just don't have the capacity to be dealing with hate mail. I like my peace. I like my little life. I don't want to deal with the trolls. Haven't had to recently.
That's good. That's one thing that, my page is called Rebel Nurse. The podcast, I changed it to Rebel Nurse. I like the idea of being a rebel and standing up against the status quo. The other side of being a trailblazer is you're going to be on the trail by yourself. And that can be difficult. You're going to find yourself by yourself for a while and taking incoming. And that's part of being a rebel. And it's not fun. Pretending like it's fun is not fair. Instead, the more realistic thing is you're going to take incoming, being comfortable, being uncomfortable. And not to say there aren't lessons to be learned, like, gosh, maybe I shouldn't have said this one thing. there's room for self-reflection. Being rebellious doesn't mean we're burning everything down. It can, or there's room, there's nuance. It's not a tightrope of rebellion. It's a canyon at any rate. Sorry you had to deal with that. That sucks.
It is what it is. I just think about other people and I hope that they can avoid a lot of what I went through. But honestly, I don't know if that's possible. I feel like it is really only getting more extreme just in terms of what people feel like they can say to you and assume about your life based off of stuff that you choose to share. Yeah, it's just interesting.
I was interviewing another nurse a few weeks ago, and she said social media is the place where nuance goes to die. I've never heard anything more true in my life. But okay, so you get your DNP, you've got the nursing the system. At some point, you're like, I'm going to go to the Netherlands. When did that happen?
Yeah. That's so funny because I actually recently recorded a podcast about this because I get that question all the time. And I was like, how do I answer this question in a way that gives enough context? Because it's never like I woke up one morning and I just knew I would leave my life behind. It was like a constant series of like micro decisions and panic and wrestling with, do I really want that? Do I not want that? Because I'd built this whole career in the US and the DNP degree does not mean much in Europe. They're not going to poo-poo your doctorate, but they don't have nurse practitioners over here. I'm not a nurse practitioner, but you have a what degree? And so here I'm just like, yeah, I have a PhD, I guess.
They understand PhD. They don't know DNP.
Yeah, well, PhD is definitely quite international. I think Canada has the DNP degree.
I think they do.
Yeah, but definitely is like North American. Of course, if I get to know someone or I'm applying for a job, I explain what the doctorate is. I don't want to misrepresent that because there is an important difference between the two. But being an international in Europe, you get asked every day, like, oh, why'd you move here? What do you do? I'm not in the grocery store going to be like, well, it's a doctor of nursing practice degree. Let me break out the nursing flow chart for you so you can understand the 400 career paths you could take as an American nurse.
It's a PhD, okay? Let me just get my apples.
I have a PhD in leadership.
There you go.
That's way simpler than the 8 words that actually describe my degree. Yeah, what was your question? I can't remember.
You're going to move to the Netherlands.
Yes. Long story short, over the course of my doctorate, was studying systems change and how to design for health. And I just kept coming back to the Netherlands because I had such an incredible time living there. And the thing that I remember the most was like, I was just happy. And as I was learning about designing healthy communities specifically in one of my classes, my program is very much like build your own sort of focus area and specialization. So I really took that to heart and was writing papers on whatever I found interesting at the moment. And I just kept getting drawn into this idea of you can design for health, your communities, your transportation networks, your buildings. And the Netherlands does that really well. There's a huge Viking culture here. Public transportation infrastructure is incredibly strong. It's very easy to live car-free here.
Yeah, I saw on Instagram you just got a bike.
Well, I've had a bike, believe me. How I get around, but I got a second bike to make my commute in Amsterdam easier. But yes, bikes are like very vital to the functioning of society here. Basically, like I was just thinking about my Dutch experience and I was like, I was so happy. And why was I so happy? And it's like, oh, well, because you live differently. I got so much exercise just going to visit friends. It's really incredible. Anyway, so the coursework kind of reintroduced me to thinking about the Netherlands, and then it was just stuck in my head like on a loop. I just kept thinking about it.
I love that. At some point you made a decision, like, okay, I'm going to go to the Netherlands. Did you find a job first, or did you go first and then find a job?
Yeah. So at this time, when I graduated with my DNP, I left my hospital operational leadership job, the ER leader job. And that was because I had a partner at the time who was moving for work. And so we'd both finished our doctorates in Minnesota at the same time. And so we had an agreement that we would then move where he was getting his job. And I had started the company a couple years ago. And so I was spending quite a few hours on that each week. So I was like, I think I might be able to just do that full time or at least part time until I find something, my next step. But that was the plan. And then I just kept thinking about the Netherlands and really wanting to make that a reality for myself. And that wasn't something that my partner was interested in. And so after a lot of discernment time and conversation, I decided to go to the Netherlands.
And what year was this?
This was 2022. I decided I was going to move. I didn't move until the beginning of 2023.
Because you finished your DMP 2022. So at about this time, you're like making big changes. You graduated your DMP and you're like, peace.
Yeah, 2022 was a big year of transition. So I did not look for a job in the Netherlands first. They have this option where if you have a certain type of degree at a certain level from a certain type of school, you can come over on a year-long visa, on an orientation year visa to look for work. So that's how I got over here initially. And then I did look for work a little bit, but I was at this point in my career where I didn't want to just take a job to take a job. And I had this business I really loved. I just kept telling myself, if I don't find something that's a really good fit, I'm not going to give up my company just to have a Dutch job. And I also knew that as an American, it's really easy to, relatively speaking, set up a business and work as a freelancer in the Netherlands and get a visa to stay. So I did that for my time after my orientation year. Now, of course, as soon as all my paperwork went through to be a freelancer, I got a call from a job that I had applied to a year prior asking if I wanted to come in for an interview. And I was like, what is this job? I don't even remember. It was a company that the name did not ring a bell. They resent me the job posting. They were like, are you still interested? And initially I was like, no. But then I opened the job link just to see. I thought I'll just look. And it was like one of the one jobs that I had found and applied to that I was genuinely excited about because it seemed like the perfect marriage of the things that I was interested in, which is business, clinical, and operations. And I was like, oh my God, I just went through all this drama of getting this startup visa here. And I had a full one-on-one client roster. And I'm like, I'll just go interview. I'll just see.
And this is for the patient navigator manager
Yeah,
that you're doing. Okay. So you went to the interview.
I did. And then I had like 6 more. And I don't think it was 6. I think it was 5. And I just kept saying, it's just a conversation. We'll just see what happens. But then the more conversations I had, I was like, oh, dang, I think I really want this job. This sounds really, really cool. Yeah. And then ultimately I got the offer and it was a no-brainer for me, to be honest. But now I'm in a position where I have this new job and I've been in it for a month and I really, really like it. And I want to stay long term because it's a global health tech scale up, but it's like really exciting and everyone's very entrepreneurial and we're having like real patient impact and closing system gaps in the clinical trial space. It's really cool. And also I have this company that I really, really love. Well, I'm kind of busy right now
That you constantly work.
at the moment, but I'm restructuring some nursing the systems stuff because I remain committed to sharing the systems thinking and change making tools with nurses. That's always going to be just a professional priority for me. But fortunately, I now have courses and programs that don't require me to be delivering content for people to learn. And so I think I'm just going to be strengthening more of that asynchronous curriculum so that I can do both.
I think what I've heard, and this is extra nursing just in general, a lot of entrepreneurs will start out in some sort of whatever their space is coaching. And then they're doing one-on-one. Sometimes they'll do groups, sometimes they'll do one-on-one. And then they develop, and then time for one-on-ones is limited. There's always a ceiling. There's only 24 hours in a day. And so even if you didn't have a day job or another job, there's going to be a ceiling to it. And so your ceiling is just lower now, but there's this idea of, okay, how can I streamline some things? How can I not step away from one-on-one, or I still want to help people, but I can't help people in this capacity anymore. I would love to do a course, but I can't come up with a good idea. You have great ideas, not me.
Funny because actually I did not start with one-on-one. I started with, it's called the personal statement writing guide. It still exists, but I kept getting questions about how do I write a personal statement to get into like nurse practitioner school. And I was like, that's easy. You just like use systems thinking. And people were like, what the hell does that mean? And I thought, oh, okay, that's not obvious. I suppose I should explain it. And people were like, yeah, please do. Like, I would love to know. And so that was the first thing I ever created. And even then I was like, it's not a business. I just have this thing and I just give it to people, but for, a cheap price because I spent some time on it. I think it's valuable, but trying to like pay my bills with this thing. But yeah, and then I created a course on how to interview effectively using systems thinking. So one-on-one actually was like one of the last things that I offered, and I really do enjoy it. I don't think I ever want to fully give it up because I think coaching nurse leaders is really, really cool. I really like it. And I think it makes me a better leader because I'm presented with all these different challenges every day from all types of organizations, and I work with nurse leaders through them. And then when I now go into work and as a manager have a similar challenge, I can be like, oh yeah, I've already like problem solved this just in a different area. I think it keeps me sharp.
I think you have such a variety of experience. You have the experience of being a nurse leader in the hospital as an ER. Were you an assistant director or a director?
My formal title was patient care supervisor, which is basically like an assistant manager.
So you have that like at the bedside, that leadership in the ER. And then you also have this systems leadership that you're talking about. And then you've done both. And then you talk about how to apply the systems to leadership for nurses who are still at the bedside. So actually, that's a good question. I haven't even gotten to it. What do you offer in nursing the system? I saw on your website, there's a tab for nurses and then there's a tab for organizations. So tell me just a little bit about that.
Sure. For nurses, I like to think about every nurse as being on a change maker journey, whether they know it or not. I don't think there's a nurse alive who has never at work looked around and said, why do we do it like that? Like, why don't we just move this over here? Or why don't we improve this process? Or why don't we fire that person because they don't know what they're doing, right? That's change making work going on in your head. Whether or not you take action on it is a different story. So I think every nurse has a change maker journey. And so as my company has evolved over the past 6 years, basically I've wanted to create resources and support for nurses at any point along that journey, from like early conception of like, I think I want to make a change, but I'm not really sure where to start, to, yeah, I'm like intentionally designing an innovative career, or I'm a nurse leader, I'm a director at this organization, and I want to strategically move my team to the next level or build our capacity to prepare for emerging challenges. I think it's really fun to be mindful of the whole spectrum that nurses can land in, because if you walk into any given department, you cannot determine how effective at making change a nurse is going to be by looking at them, or by understanding how long they've worked somewhere, or understanding if they're an RN or an LPN or a nurse practitioner, or they have a master's or not. Change making is comprised of multiple skill sets that need to be intentionally developed. And we currently in nursing don't have a clear-cut way to do that. That's the gap that I want to fill. Is I know not every nurse is going to be like, yes, I want to dedicate my career to making systems level change. And that's okay. I think that's fine. But for the nurses who do want to embrace that role of change maker and to whatever degree become effective at making improvements or even rendering transformation for their teams, I want to be here to help.
Yeah, that's cool. And where do people find you?
My website is nursingthesystem.com. Pretty easy one. And then I'm on Instagram at nursing.the.system. So everything is nursing the system, just to keep it simple.
I love that. And so patient navigator, manager, and entrepreneur. That's so cool.
Yeah. I haven't talked much about my day job. I'm really quite new to it. So I don't want to like wax poetic about all there is to know about the clinical trials, health tech world, because I'm still learning a lot of it myself. But I think it's a great example of a lot of my patient navigators on my team are nurses or nurse practitioners or physicians who are from all over the world and are now doing remote patient care work service to helping expand access to patients who have serious diseases, who are interested in exploring their clinical trial options, or seeing what expanded access programs they might have access to get pre-approved treatments. I love leading that team because it's a great example of how nurses having options is so valuable. And there are so many jobs out there that you don't even realize exist. And maybe because they haven't even been conceived of yet. It's really exciting.
I saw your story. One, I saw you on Instagram, but I didn't know that you were an ER nurse until I, read your bio on your website. But You said that nursing wasn't really presented to you as an option as a career because you grew up in Silicon Valley. I'm the opposite. I'm from a small town in Texas. Our local junior college had a nursing school. So many people went to that nursing school. And so it was an option for us. But never was it ever discussed that you could become a patient navigator manager in the Netherlands.
Yeah, I didn't get that one either.
I knew that you worked in the Netherlands and you had just gotten a job, on your Instagram. And I'm like, well, how interesting. Let me see if she'll come on the podcast because I know that you have a business, which I'm all about nurses having side hustles, or maybe not even a side hustle, your whole business, whatever. But what's your journey? I'm sure other nurses are interested in this. I'm sure they've wanted to know if they could work abroad or, oh, you can start a business. Oh, or hey, I want to make some change. I don't even know where to start. Maybe I'll take one of her not little courses, but take one of her courses. I love a course. I will sign up.
Some of them are little. It's funny you said that because yesterday just released my first mini course. And so it's literally a little course.
Great. There's options. There's minis. I'm sure you have longer courses. Again, I'm with the options. But I'm like, how interesting. Because I'm sure nurses, this wasn't even on their radar. Great. Now it is. They're going to get so much from this episode about if they wanted to work abroad. Is it possible? Yes. Maybe they want to stay local and they do want to make a change, but they don't know where to start. Well, here's a resource, nursingthesystem.com. Go for it. Go look. Where can they find you on Instagram? Because you have great information on there too. I think you've got some free resources that you offer as well. And there's just so much. And I didn't know this before I interviewed you, but you had a degree in sociology. And I like showing different perspectives of how people got into nursing because nurses are so varied and diverse in all kinds of ways. And one of the ways is how they got into nursing. Some people just needed a job and they had a local nursing school and that's where they went. Great. Who cares? It's not my business to tell you why you should get into nursing. But others might be like you, or they might be you where they're like, no, I felt like deep in my heart that this was something bigger and I could use it to change systems. Great. There are other people who either aspired to that or didn't know about it and now they're interested. But that's what this is all about, is showing options and then people pick. The bigger part for me, options lead to freedom in so many ways. And if nurses feel they have an option, if you want to leave the profession, go ahead. I'm not here to tell you what to do. I'm here to give you options. And you can decide what to do with your own life. And that's what I love about it. So thank you for coming on, nursingthesystem.com. And then I want to get into my little questions. I haven't figured out what to call this portion yet. Is it rapid fire? Is it 5 questions? I don't know. It's the get to know you section. Here's a good one. What was your first job ever?
Oh my God. It was probably babysitter or something like that.
I worked at Sears Service Center where they fixed lawnmowers. I was 16. They hired me. People would yell at me because their washers broke. Babysitter, that's solid. Everyone does some babysitting in their teenage years, I think.
Yeah, I think my official one with a paycheck recognized by the government was probably in college. I was the assistant at the study abroad office, but it had a fancy name. It was like Global Citizen Office or something. Office for Global Citizenship. That's it.
That sounds so fancy.
Yeah, I made copies, but yeah, super elite.
Hey, fake it till you make it. You're elite now. In college, I worked at the library. I don't know what the title was. It was part of the work study program, but I'm the one who put the tapes in the book. So if you tried to take it out, it would get you. And then I put the date due stickers on the inside. I put stamps. We processed all the books in the back. It was very fancy. And then I was, for a year, a molecular biology research assistant. I didn't do any research. We spun down DNA. We made, what are they called? Those libraries, clonal libraries. I worked for someone who was getting their master's. I just did it for a year. But anyway, this isn't about me. Okay. The Netherlands. What's your favorite thing about living in the Netherlands?
Oh, that's so hard. Rapid fire. Here we go. Besides the biking, which I've talked about exhaustively, I really like that I live 20 minutes from the Amsterdam airport and I can basically go anywhere in the world that I want very, very conveniently.
I love that. Where do you want to go next? Do you have a little trip planned?
Oh, I'm going to the US in March for a conference and to visit my family. but that is not on my top destination list, I will say, having lived there for many years. Where am I going next? I'm going to Spain to go to a music festival in the summer. Last year, I went to 12 countries or something. It was so busy. A lot of it was for work. But this year, one of my New Year's resolutions was less travel. We're keeping it more chill.
Travel is exhausting. It's awesome and you want to do it, but I'm like, we gotta like dial this back.
Yeah, it was too much for sure.
I would come home, the bags would stay packed and half unpacked, and then you just toss things out just to put things in because you have to go back to your day job or back to your business working it. And then you're like, okay, off to the next. And then you're like, I'm a shell of a human being here. Okay. Are the tulips really that beautiful?
Oh, theoretically. So the beautiful tulip garden amusement park that has all the tulips called Kokerhof that a lot of people go to is very beautiful, but you need to go before they all start to die. I went at the end of the season. My friend bought me tickets for my birthday and we went, and it was like after a big windstorm and it was tragic. Yeah, theoretically, I've yet to see it myself with my own eyes.
You Google it, and then the first thing you see are tulips, and then there's a windmill in the back. And you're like, oh. And so I just wanted to know, like, is this the truth or is the Google lying to me?
It's true from like April 1st to April 30th. You got to get in there.
So I lived in DC for years.
I lived in Leesburg, Virginia for 4 years.
My BSN's from Georgetown, so I lived about a mile north, and then I've lived in Alexandria, and then I've lived sprinkled around there. But the cherry blossoms, it's the same thing. It might be shorter than a month, and you have to time it. It's like a week at the max, and you better be right there or it's over. It's beautiful. Where I lived, there was an apartment, and it had this massive cherry blossom out, the living room window. And it was like a hue of pink when it was blooming. And it was short-lived, a week or two, but it was so beautiful. They have that cherry blossom 10 miler that I think is like a lottery to get in now. And it's hit or miss if you're going to see any cherry blossoms on the cherry blossom 10 miler.
They'll be on the trees or on the floor rotting.
There'll be nice pictures on your little invite to run. Last one. Do you speak Dutch? Are you going to learn it?
Oh, ik spreek een beetje Nederlands, but it's horrible. It's really not very good. I think my accent is okay, but I'm at the A2 level and I need to take more classes, but they're so expensive. But I do. I speak more than I think the average expat, so people are always really excited to hear me try to speak to them in Dutch.
That you don't speak it perfectly?
Oh, no. Here, no, not at all.
Okay.
It's not like France, no offense, France, but so many people here speak English, especially when you're near the larger cities. I don't live in Amsterdam. I live just outside of it in Haarlem. So it's like kind of a treat if you try to speak Dutch. And most people will just speak to you in English, so you almost have to fight to practice, which is part of why it's hard to advance because everyone's just so accommodating. And they also think their English is really good. And a lot of times it is, but sometimes it's not. And so you're like, okay, we can do English, but people here can speak like Dutch, German, English, and French or Greek. It's very impressive.
But if someone wanted to go, they could probably get around with English.
Oh, for sure. Unless you're going to some rural village in the middle of the country and you only talk to people over the age of 70. I can't imagine someone would plan that trip, but more power to you.
What kind of trip is that? Claire, we'll end it there. So let's review. They can find you. Your website is nursingthesystem.com. Your Instagram is nursing.the.system. And then there was one other place. Was there another place?
Podcast. Nursing the System podcast.
Okay, great. Claire, thank you for being here.
Thank you so much for having me. This was honestly super fun.
Thanks for tuning in. If you loved what you heard, do me a favor and share it with a fellow nurse who could use a dose of inspiration. And I'd love to hear your favorite takeaway. Post it on Instagram, tag me at ShopRebelNurse, and let's keep the conversation going. Until next time, stay a rebel.